2013, which is all about supporting effective clinical supervision, really echoes these things. So it says that the benefits for staff are about managing the personal professional demands of the nature of their work. These are all bits that I've cut out of this document, essentially. That it can allow staff to reflect on and challenge their practice in a safe and confidential environment, that they receive feedback on their skills that's separate from managerial considerations. It's a part of their professional development and can contribute towards maintaining their accreditations. CQC says benefits for service users are about that high quality care from staff who are able to manage the personal and emotional impact of their practice. I should say there is some evidence that supervision is associated with client outcome, but it's actually really scant. The reason for this is it's just jolly hard to do really controlled research about supervision, because it's quite unethical to say we're going to send a whole load of people who are completely unsupervised to treat one group of patients and send a whole load of supervised people to treat another group of patients. Hi, Tim. I think you might be across the hall. Department head is about to come and induct us onto a Masters in Clinical Psychology program as we speak. So one example of a study where actually there was a naturalistic opportunity to do this kind of research was Bambling and colleagues in 2006, where it ended up that some people were supervised and some people were unsupervised, because that was, I think it was, if my memory serves me right, it was in Australia, and just by virtue of practicalities, some therapists had supervision and some therapists didn't. And in total, there were 127 therapist-patient dyads that were considered. And those who were in the condition where their therapist had been supervised did better, reported better therapeutic alliance, better improvement on the Beck depression inventory, and better satisfaction with therapy, and also low dropout rate. But what was also interesting is that there wasn't actually any difference in adherence to, I think it was CBT for depression protocols that the therapists were delivering. So there are some benefits, but not across the board. There was a nice review actually published this year by Alfonson and colleagues, and they looked at all the literature that is out there in terms of clinical supervision in CBT and the effects of it, and they just found this total lack of evidence. Actually, every study has a real problem with it. So although I think we all know intuitively that, of course, it benefits patients, it benefits institutions, it benefits staff, it's really hard to really disentangle that from everything else that goes on in clinical services and to be able to make definitive conclusions about it from a research perspective. Benefits from the organisation that CQC recognise are it's about culture of the organisation, critical in setting tone. Like you said, it's associated with higher levels of job satisfaction, improved retention, reduced staff turnover and staff effectiveness. And it's actually a way that the organisation can fulfil their duty of care to staff, as well as, of course, accountability, clinical governance, etc. So the reason I labour this point is because I think actually seeing the CQC say this, again, puts you in a powerful position when you've got to argue for needing more supervision in your services, which at least I found over my years working in clinical services was a conversation I was frequently having about why supervision was so important. The other thing that's important to think about